said, if you've got any questions, please put them in the chat, and we will pick them up as we go along. There will be a Q&A opportunity towards the end as well. So if anyone's got any questions, again, time permitting, if you've got time, we will allow open questions towards the end as well. So really just enjoy the event. And just to tell you a bit about our background, the Community Inclusion Team, we're part of the Black Country Healthcare NHS Foundation Trust. The Trust provides specialist mental health, learning disability and community healthcare services for the population of the Black Country. And we really pride ourselves in putting our patients, service users at the heart of everything that we do here. A wide range of services include adult neurodevelopment services, community recovery team, eating disorders, employment services, health visiting, and community learning disabilities. All our services staff within these see patients every day as individuals and will treat patients as individuals. They will work together with you to achieve happier and healthier lives. So we will just move on now when I introduce our first speaker, Agnes, who is our lead governor, to say a few words and then open up the event. So over to you, Agnes.
Hi, my name's Agnes. I'm lead governor for the Trust, but I'm also a lived experience consultant. This subject is very much to my heart. I've had a lot of people with dementia and Alzheimer's in my family. My two brothers died in their early 60s. My father died in older adults. My mother has multi-infarct dementia, and my mother-in-law has just recently died with Alzheimer's. So you can see it's something that I'm really passionate about. I wish when I was looking after my parents a few years ago that I actually had meetings like this that I could come to. I think it's absolutely fantastic. The speakers that you've got today, there is so much information, so much knowledge, so much signposting to support that you can actually get. As a trust, we have very good memory clinics. My husband just recently been referred to one, so the support that the memory clinics are actually giving us is fantastic. The support that we give on wards for inpatients, the support that carers are getting as well, we really do. It's something at the heart of the Black Country as well. As I say, I'm very passionate about it. If anybody wants to ask me anything about it later, that's not a problem. As I say, what I would say is learn from today's event. If you're a carer, I hope that you actually get a lot of positive feedback in the fact that, as carers, we're not always taken into true consideration, but as a trust we do. So as I say, for staff, get the knowledge on how to treat service users with dementia, Alzheimer's, and their carers. For carers, learn where hopefully you'll get signposted to things that will actually help you. As I say, Yasmin, thanks very much for inviting me. Yeah, I would just say sit back, enjoy it, take in what you can. It's been recorded, so you don't have to worry so much about taking notes, because sometimes when there's lots of speakers, we get lost in note taking. So you can always get the recording, which is excellent. Really good to see so many people here. And as I say, just sit back, enjoy the day. Lots of information. So just enjoy.
That's brilliant. Thank you very much for those kind words, Agnes. Really appreciate you being here as well and sharing your thoughts. And thank you for opening up the event as well. And like Agnes said, with the event is being recorded, and we will share the recording and the slides with you as well. So just sit back, relax, and just take in as much as you can. We'll just follow on to our first speaker. Now I'd like to introduce Janice. from the Alzheimer's Society. Janice joined the Alzheimer's Society in 1997 after being made redundant from the National Health Service. She originally came for 6 months and 26 years later is still here. So she must be doing something really, really good. She was drawn into the world of dementia and wants to improve the lives of those affected by dementia. She's the area manager for Birmingham, Solihull, Coventry and Warwickshire and the Black Country. In this role, Janice is responsible for a team of staff delivering a range of services to support people with dementia and their families living in the community. Janice says everyone living with dementia is an individual and you need to get to know them as a person. When you have met one person with dementia, you have only met one person with dementia. So I'd like to introduce and hand over to Janice. Over to you, Janice. Thank you.
Good morning, everybody, and thank you for inviting me to speak to you all today. I'm looking at the numbers here, and we've just hit 300, so that's an incredible number of people to speak to today. So thank you very much. Yeah, I am going to talk about what is dementia. I've only been given 20 minutes, so that's a lot to cover in 20 minutes. I think we're going to kick off with a little video first, aren't we, Yazin? If we could have the video first, that would be great.
Yes.
Fancy a cuppa?
Oh, that'd be nice.
Coming up.
You okay?
Yeah, couldn't remember where the tea bags were.
They're here.
Oh yeah.
I'm exhausted.
I, Laura, take you, Adam, to be my husband, to have and to hold from this day forward.
I know that. I know how to make a cup of tea, you know.
For better, for worse, for richer, for poorer.
I'm so sorry, Laura.
No. Please.
In sickness,
You've stolen their tea bags.
That's it.
in sickness,
Adam.
in sickness.
I want to go home.
What?
I want to go home.
And in health,
Yes.
to love and to cherish, till death do us part. I do.
We vowed to help end the devastation caused by dementia, but we can't do it without you.
Okay, thank you. I don't know how that makes you feel. I mean, I've watched that many times already, but the first time I saw that, I cried. And I've been working with people with dementia for over 26 years. It's a hard-hitting advert, but it tells the true story. Yeah, because these people putting in the chat, crying already. Yeah. Right. So let's share my presentation now. If I can find it. Here we go. Okay, so what is dementia? It's a big problem. 900,000 people living in the UK with dementia today, and figure is expected to rise to 1.6 million. And this year alone, another 209,000 will develop dementia. 14,000 of those people of age over 65 are living in the Black Country. There's a new case of dementia somewhere in the world every 3 seconds. So I'm speaking to you probably for about 20 minutes. That's 20 new people a minute. By the time I finish speaking, that's 400 new people somewhere in the world. Over half of people fear dementia diagnosis, and 62% think it means life is over. In fact, dementia now is the disease that people fear the most. So what I'm going to try and quickly cover in my 20 minutes is what is dementia, different types of dementia, the symptoms that we look for, communicating with people with dementia and how we can live well. Now, I can't see the chat box now because I'm thinking, so perhaps we'll do this a little bit different to what I was going to do it. So dementia is not a natural part of, and you've got some words down the side there. Think for yourself what that could be. Dementia is caused by something of the brain. Dementia is not just about, it is possible to, with dementia, and there is to the person than the dementia. So dementia is not a natural part of aging. Dementia is caused by diseases of the brain. It's not just about losing your memory. It is possible to live well, and there is more to the person than the dementia. So dementia is not a natural part of aging. Most people seem to think that dementia is an old age disease. I would agree that the majority of people who do get dementia, it does come to you later in life. But there are a lot of people in the UK. In fact, there are 40,000 people in the UK with early onset dementia. So that's what we call under 65s. So you can think how that might affect them in a different way. Some people are still working. Some people have got mortgages. Some people have got young children, young families. So that's a very different way of looking at dementia. But as we get older, there are more of us. 1 in 14 over the age of 65, which goes to 1 in 6 over the age of 80. And the thing about dementia is that we've done well with curing lots of other things. We've done well with curing heart disease, cancers, things like that. But at the moment, we know that there is no cure for dementia. Research is going on in leaps and bounds, and you will have heard in the last few weeks, there are now two new drugs sort of on the horizon that could help us with dementia. It's caused by diseases of the brain. In the same way that any other organ can have damage from a disease, for example, the kidney, the heart, dementia is caused when diseases physically damage the brain. Imagine the brain is a collection of thousands of fairy lights. Each fairy light on the brain would be a memory, a skill, or a function. If you had dementia, things would be happening to those fairy lights. The first click would make them flicker. The second click would make it dim. And the third click might switch off those completely. For each person who is affected, this will happen in a different order and different lights will go out. But just like other diseases, a healthy lifestyle is something that can help. Something that features regular exercise, a balanced diet, and not smoking can help you reduce your chance of developing dementia. What's good for your heart is also good for your head. People are often confused about what is dementia, and you confuse the term dementia, Alzheimer's disease. Dementia is the all-embracing term. It's the umbrella term. There are actually well over 100 different forms of dementia, but the ones that we hear about the most are the 4 that you can see on the screen there: Alzheimer's disease, vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. And they all present in a very slightly different way. Alzheimer's disease is like a slope progression. So over a number of years, you'll see a gradual decline in someone's condition. Vascular dementia is the other most common one, and that's usually associated with mini strokes or TIAs. And that could be a step approach. So someone will have a stroke, they'll deteriorate, and then they'll stay the same for quite a while. Then they might have another little mini stroke and they'll step down a bit, and then they'll stay the same, and then another little stroke and things like that. And as time progresses, there will be the deterioration. Some people do have both. They have Alzheimer's and vascular dementia. The other 2 that you will hear about, dementia with Lewy bodies, frontotemporal, these are the ones where people get hallucinations or have changes in mostly in their inhibitions, because it's the front part of the brain that's been affected. But it's not just about losing your memory. Think back to the fairy lights. What functions does the brain control that could also be affected by dementia? Here are some of the things. So motor skills, so your mobility, climbing up the stairs, using a knife and fork. Often people with dementia use the inability as time progresses to use a knife and fork, so eating becomes a problem. That's why we would recommend things like finger foods for later life. Sequencing, getting dressed. So a good idea for someone, if you're living with someone with dementia, is to put clothes out for them on the bed in the morning in the order in which they need to go up, be put on. One of the early stages where we can notice where people can't develop dementia is perhaps a lady who's a good cook suddenly forgets a vital ingredient in a recipe, or puts salt in instead of sugar in a cake, for example, or can't use the washing machine anymore because doesn't know how the order of things that go on. You could say that applies to many men anyway, because they can't use washing machines. But for women, that's quite a common thing that we see. Changes in inhibition. So from someone who may have been previously shy or quiet, suddenly becomes very outgoing, very outspoken, may use language that they haven't used before, maybe start swearing or saying things that they are inappropriate in inappropriate situations. And visual perception, I could do you a whole presentation on visual perception and environments. Our environment is very important for people with dementia because they perceive shapes and colours in different ways to we do. So if you've got a blue floor, for example, that could be perceived as water. So if some people with dementia won't walk on that. If there's a black mat by your front door, that can be perceived as a hole, so people won't step on it. So sometimes that is used as a barrier to stop people leaving a building. If there is a pattern, for example, if there are flowers on the wall, some people try to pick those because their perception is gone in terms of how they see things. And communication, that's a major thing for people. How can we help people with their communication? Word finding is often difficult, and I think it's sometimes good to have an agreement with someone with dementia. If they are struggling to find words, some people like you to chip in and say, suggest a word. Others prefer to try to do it for themselves. It's how you agree it with that person. But what you can do with helping with the communication is listen carefully to what people say. Reduce distractions, so cut down noise, cut down the TV sound perhaps, and think about the background, about what's going on. Speak clearly, slowly, in short sentences. Don't ask too many questions all at once. Body language is really important. Facial expressions especially can tell so much. My husband says he can tell what I'm thinking even without me saying anything, because my face will tell him everything. But the way you hold yourself, the way you position yourself when you're talking to someone, for example, if they're sitting in a chair, go down to their level so that they can understand. Use aids like clocks, pictures. If you're showing people menus and things, it's good to have a picture of what the food might look like so they know what to expect. And treat people with respect. It's how we would want to be treated. And it is possible to live well with dementia. This is our fourth key message. But living well means different things for different people. We're not saying that dementia doesn't bring challenges, but despite these challenges, it's still possible to live well. So it's still about going out and having a nice time. This gentleman is wearing an England football scarf. You mentioned the football clubs in the Black Country. So if they like to go to the football, still take them to the football. They will enjoy the experience just the same. People don't stop liking things just because they have dementia. Encourage them to do things. There are some activities now specifically for people with dementia, but what we try to encourage people is to go to everyday ones, but then teach maybe the leaders of a class how to behave. So a keep fit class for someone with dementia is really good. Singing for the brain, that's a really good thing that people love doing, getting involved in music. And you often find that people who won't communicate normally will communicate through song or music. It's a really good fun thing to do for people with dementia. But still try to encourage them. Walking is a really good one. There are lots of great things you can still do. Your life doesn't stop just because you've got dementia. We just need to adapt the way that we do things to encourage people to do them. And there's more to the person with dementia. I think I said in my little introduction, Yassine said, you need to get to know the person. You need to find out about them. And I'll just give you a little story here. There was a man living in a nursing home, and every day he would sit on a chair in a corridor. Every time somebody walked past, he would start to become agitated and upset, shouting at people and waving his arms. Staff and residents began to avoid him, and he became isolated and lonely. One day, his relatives visited, and they began to talk about his past. They shared that during the war, he worked in the bomb disposal division, and his job was to sit next to a landmine area and guide people through on the safe path. The staff realised the man was reliving this part of his life, and when he was shouting, he believed that people were walking through the minefield, ignoring his directions. This changed the staff's approach, and from then on, every time they passed him on the corridor, they would stop and ask him to guide them through. It took a few seconds longer to walk up the corridor, but had a huge positive impact on the man's life. He was no longer frustrated, but instead he had a purpose again. People engaged with him. They talked to him about his time in the war, and they saw him with renewed respect. His quality of life improved, supporting him to live well with dementia. There is more to people than dementia. We've all got a story to tell about what we've done in our past. So those were our 5 key messages. So how can the Alzheimer's Society help you? So living with dementia can be overwhelming, but you're not alone. From a listening ear on the phone to a visit in person, from practical tips and advice to opportunities to connect with others, we're here for you no matter how much you need us. No matter what type of dementia you have, we're here for you. And we support families, carers, people with dementia, professionals, anybody who wants any sort of support, you can come to the Alzheimer's Society. So this is what we provide locally. Now this will vary according to where you live in the Black Country, as different parts of the Black Country have different services. But overall, this is what we do. So we have dementia advisors who are available on the telephone, and we offer a sort of an extended hours service. So into the evenings, weekends, there is always someone there on the phone to talk to you. And if they feel that you need some more intensive support, they will refer you to our team of community dementia advisors, who will come out in the community, do face-to-face visits with people. Now, I saw Alex had joined the talk. So we have a special service in Sandwell, the Sandwell Dementia Support Service, which we are part of a partnership, which is a much bigger service. We also deliver dementia cafes. We have carer information programs. I mentioned Singing for the Brain. Dementia Voice is a group for people with dementia who want to contribute things, maybe consulted on different policies, get involved in events. Something we're going to be doing recently was going to go and do a tour of New Street Station and sort of see if we can improve that sort of thing. We do lots of community engagement events, and we have an online services directory where you can go onto our website, tap in your postcode, and it will tell you what services are close to you. So we offer all of those things locally. Nationally, we have the Dementia Support Line, which is a national offer. We have masses of information through our website, fact sheets, publications, magazines, loads of books. Talking Point, which is an online chat room, which is open 24 hours. Any time of night or day, you'll find someone on there who can help you if you've got a problem. And lots of people use it through the night, which I know is one of those times when you can't sleep and you need help. We can help people set up lasting power of attorney. We talked a little bit about research earlier, with new drugs. So there's lots through there. You can help be involved in research projects, and our website. And our online shop has loads of gadgets and different things that people can access, which help them on their day-to-day living. One of the things, it's not a very good clear picture there, but one of the things we have done through our Action Week, which is this week, is we've produced a My Checklist for possible dementia symptoms. You can find that on our website, and this is a little sort of tick list thing that you can go through that can help sort of determine whether someone you might think might have early stages of dementia. I'm conscious my time's running out. So the last thing I really want to say to you here is, put yourself in their shoes. How would you feel? What would you want? Where would you want to go? How would you like to be treated? This is the important thing I always think about, is if you have dementia, think about what you would want. And that's how you contact us, through our website, or this is our phone number, our Dementia Connect number, our Dementia Connect helpline, which there is an office based in Birmingham at Tricorn House, but it will put you in touch with local dementia advisors who are working in the Black Country. We've got a team who are based in the Black Country, and we can help come out and support you. That's the end of my presentation.
Thank you very much for that, Janice. Really appreciate that. A very, very comprehensive presentation there. Lots of great information and really giving us an insight into the Alzheimer's disease, how it can impact people, and really how and where they can get the support from as well. It's quite interesting to hear about some of the research that you talked about, and especially some of the new drugs that are being developed or tested. Do we kind of have any time scale as to how that is progressing with regards to the research into new drugs?
No, I can't answer that question because I'm not in the research field, but it's imminent, but it still could be a little while away. That's as much as I can say. So, and I believe that the new drugs will only really help people who are in the early stages of dementia. There is medication available for most people now, can access something which sort of levels people off, but the new drugs I think will be available in the next year or so, hopefully. But it really is for people who are early stages. So we would encourage people to get to go for a diagnosis as soon as possible, because the earlier you go for a diagnosis, the earlier you can access medication, and you will have access to support as soon as you can, really. I know people are sometimes afraid of getting that diagnosis because it's sort of like a feeling that you know, we've given them that sort of finality. But for many people, it's a relief to get a diagnosis, because it does actually explain why things are happening, and also can put, as I say, put you in touch with other people and allow you to have some medication, which can help.
Yeah, thank you for that. Okay, I think we have got some really good comments in the chat box, and I think we have got some questions in there as well. I think Jenny's been keeping an eye tab on some of the questions. It may be worth, if you want to, Janice, also just try and answer some of the questions within the chat as well. It might make it easier. I can
see a few. Do you want me to answer them in the chat or answer them now?
Yeah, it would be better. Yeah, if you can, like I said, and if you've got time towards the end, you know, we will open it up for any questions as well. So yeah, that would be good. We will now move on to, I'm just looking at the time as well. So on to our next speaker, who is, bear with me a second, Sunita Devi. So Sunita is a qualified mental health nurse, and prior to her current role was a mental health nurse working within the West Midlands Ambulance and the NHS 111 service. Sunita believes her current role as a diverse community admiral nurse allows her to flourish, develop and coordinate a centred and dementia care in the areas of the Black Country. So I'll now hand over to Sunita.
Hello, thank you everyone for attending today. Let me just share my screen. Can you all see that?
Not yet.
Let me just.
Yeah, something's happening now.
Okay. So as Yasin said, my name's Sunita and I'm an admin nurse for diverse communities. I've just recently joined the post on the 1st of September last year, and it's a role which is close to my heart. I've been working in care since 1999, working with people, older people with dementia. So this is my slide. So just a little bit about what inspired me to become a mental health nurse. So my passion to become a mental health nurse was the challenging upbringing, which I experienced during my childhood in the Asian community I was born and raised in. It was made for me to believe that education wasn't for a female, and it wasn't necessary for me to complete my studies. And once I completed my studies, it was expected for me to get married, which I got married at the age of 16, and then expected that I would be staying at home looking after my partner and children. So that's just briefly about me, and that's the reason to why I've chosen the role I'm in, because I just wanted to get into knowing how other people were brought up and how they were coping and how they were managing. So what I'm going to be talking about is diverse communities and dementia. So this is just an explanation of what diverse is made up of. So it's made up of people from a range of different social and ethnic backgrounds and of different genders and sexual orientation. Oops, sorry. And also a little bit about dementia. So sorry, I've just on one slide forward, but a little bit about dementia. So it's not normal for your memory to be affected by stress, tiredness, or even certain illnesses and medicines. But if you're becoming increasingly forgetful, it's a good idea for you to speak to your GP about early signs of dementia. So memory loss can be increasing. You can be increasingly forgetful, and it also can affect your daily life. So it's worth for you to speak to your GP. Dementia is not only about memory loss, but it's about it affects how you speak, how you think, and also how you behave. So it's important to remember that dementia is not a natural part of aging. So my role as an admin nurse for diverse communities is to deliver and to coordinate person-centred dementia care within the Black Country Healthcare NHS Foundation Trust. In order to improve the experience of carers, families affected by dementia from diverse and underserved backgrounds. The Black Country is one of the most ethnically and culturally diverse places in the UK. And today I'm going to talk more about and focus on communities which I believe aren't really spoken about. Okay. So issues faced and affected by dementia are, let me just move this, by the LGBT plus community. So older LGBT plus people may lack support from their family. For example, services for, so they are more likely to be living on their own or be single. Stigma, unfortunately will be present, especially amongst over 65s. And most caring settings advertise with opposite sex couples. Group activities may be difficult for them to take part in, as they may feel the need to miss out on important parts of their life, or receive negative responses. Families may be unsupportive or sexuality or gender change. So therefore they may not disclose their identity to staff. Residents and patients or service users may react and engage negatively. Transgender people may revert back to their birth gender, so with their dementia. And also transgender people may live with medical issues relating to gender they were born with that begin to emerge with age. And this is just a little bit about friends and families and travellers. It's a leading national charity that works on behalf of all gypsies, Roma and travellers, regardless of ethnicity, cultural background. So this was a research which was undertook by Simon and Sarah in July 2018 to find out more about awareness of the symptoms of dementia in gypsy and traveller communities, awareness of ways to reduce the risk of dementia, and also to find out more about access to care and support for dementia. So awareness of dementia and recommendations. So whilst majority of those surveyed identified forgetfulness and confusion as a sign of dementia, only 65% recognised that changes in behaviour which are out of character is a sign of dementia. This shows a reasonable high awareness of the signs of dementia with the same room for improvement. However, from the group surveyed, 55 of the participants said that they did not know that eating healthy, doing more physical activities or managing existing healthcare could help to reduce the risks of dementia. This shows that there is a lack of awareness of ways to reduce the risks of dementia. Oh, sorry, I don't know. Sorry, I'm not so good at technology. So, so the key findings were that campaigns raising awareness about risks of reduction activities to prevent dementia are not often reaching gypsy and traveller communities. Also, a large number of gypsies and travellers would not attempt to access support for dementia because they felt that they would not receive culturally appropriate care. A majority of the gypsies and travellers shared a strong preference for carers from within the gypsy community. And there's a number of reasons why health information and services about reducing the risk of dementia is not being reached out to the gypsy traveller communities. And the key barriers are were identified were that friends, families and travellers, service users had low or no literacy, and this is keeping within the 2011 census of England and Wales, which found that only 40% of gypsy and travellers hadn't had any formal qualifications, and most of them were saying that they don't understand, that the services don't understand their culture and they're afraid to be locked up in a home. And also in the 2011 census of England, gypsies and travellers were found to be the ethnic group with the highest number of providers of unpaid care. In some cases, members of the gypsies and travelling communities may not be aware of the support and financial support that's available to carers within the family. So this is the reason to why they don't reach out for advice and help and support. And also there's a fear around accessing support services for dementia. because they felt that they were going to be locked up and put away into a home. However, majority of them would want to take someone with, they don't want anybody to be burdened with the with any kind of support and advice. And the recommendations are that clinical commissioning groups should develop resources on dementia in partnership with GIPSY and travelling community members, ensuring that these are accessible for anyone who with low literacy. Clinical commissioning groups should ensure that health practitioners work with people with dementia and their families, and providing culturally appropriate care and support. Clinical commissioning groups should commission services to deliver assertive outreach to GIPSY and travelling communities who may otherwise not be linked into services. GP should ensure that memory assessment questions are relevant to GIPSY and traveller communities and not depend more on literacy to take part. And adult social services should ensure that if preferred, GIPSY and travelling people with dementia should be cared for by members of their own community, because that's what they prefer. Adult social services should also ensure that wherever possible, those with dementia should be supported to stay in the accommodation of their choice. Just going back to the LGBT plus community, it's just that I had, I think I had skipped a slide. Just wanted to talk about what are the simple things that we can put in place to ensure that they are supported, to be aware that their family are not, may not be blood related, yet still have the same legal rights and amount of input into their care, to allow the partners of the resident to be affectionate and without being too judgmental. People should be trained on how to use LGBT plus appropriate language, and also to create a dementia LGBT plus story or resource using videos of training and resource for LGBT plus people who are affected by dementia, and also to bring in LGBT plus services for people for talks, and dementia services and LGBT plus organisations to provide information about each other's services, and organisations to commit to a policy check, e.g. maybe a next of kin policy check. And also organisations should be encouraged to become dementia friendly from the LGBT plus community, and present same-sex couples in materials, because most of the advertising for care homes or are mainly not appropriate. So, you know, maybe present same-sex couples in materials and not automatically assume that everyone is in a relationship, and also for them to use open and inclusive language. And that's me. Thank you for attending. Sorry, I think I'm not too good at technology, so I think I've skipped a few slides. I hope that's useful to you all.
That's brilliant. Really, really appreciate that, Sunita. And it really kind of gives us an insight as to how dementia can kind of impact people from different backgrounds, different cultures, and also different genders as well, and the work that's really needed to support. So really appreciate that. Thank you very much indeed. Just want to move on to a small exercise now, which means everyone here in the audience, have got to do some work. I'm going to hand over to Adam. We're just going to do a small survey. It's a Mentimeter survey poll, and you can all take part. And Adam will just go through the instructions as to how you can participate.
So if you go on to www.menti.com and use the code at the top, then it should prompt you to then answer the question.
Yeah, so just as Adam said, you just need to log on to a different device on your phone or something. Just go to that website at the top, www.menti.com, and use the code there. Can we put the code in the chat as well, please? Brilliant, thank you, Jenny. Yeah, so just use that code and it will just take you to the question, and all you do is just put in a answer, whatever answer you want. And hopefully at some point, it should start appearing on the screen, the answers. Is that right, Adam? Yeah. There we go. We can see some of the responses coming through now already.
Yes. Yes, Ian, it's Dementia here. Hiya. Do you have to do this now, or can you go back to a later date?
No, you can take part in it now. So yeah.
You can do it now, or can
Yeah,
you
can do it.
go on to the WW later?
Yeah. No, it won't allow you to go later now. I think this needs to be done now.
Okay.
But what we will do is we'll save the slides, the responses, and those will be sent out to you. So don't worry too much.
Oh, okay.
Yeah.
Okay. Thank you.
Yeah, some really interesting responses we're getting back here, as you can see. If you don't have another device, if you're logged onto a laptop, you can just open up another browsing page and just copy and paste that website into your browser. It will allow you to open up a separate screen. Sorry, I'm just trying to keep up with the responses. Some really interesting responses coming through. Oh, brilliant. Thanks for that, Lottie. Yeah. So if you are struggling to get onto the Mentimeter, you can just, as Lottie said, put your comments in the chat box and then we can transfer them over into the Menti poll later on. Okay, I think we will continue with this because I can see some really interesting comments coming through, and it's still people are still feeding into the Menti poll as well. You can carry on, but I'm just looking at the time, and I think we will move on to our next speaker as we go along. So I just want to introduce our next speaker, who is Meena Patel. She has a lived experience, and she wants to share her lived experience with us. So I'll hand over to Meena.
Thank you. Good morning, everyone. My name is Meena Patel, and both my parents have had dementia. And if you don't mind, I'm going to switch my camera off because I've not done anything like this for quite a while now. Thank you. Right. I'm an only child, and both my parents have been affected with dementia. My mum had slow progress in dementia for over 13 years. I had never experienced anyone having dementia, maybe because a lot of my family were back home in India. My parents were first generation to arrive in the country and knew nothing about it too. Mum was just a typical Indian lady. Although she went to work in her earlier days, she just loved to run around her family, cook beautiful food and keep the house clean. In my childhood, Mum spoke about her father, how he used to leave home and look for my nanny when nanny had passed away. And I thought nothing more about it. They put it down to an age-related illness. As time went on, I would come home from work and Dad would complain that Mum kept asking him the same questions over and over again. He would go on to say the food was very spicy on occasions. He would say there was too much salt on other occasions. He would say there was no salt on other occasions. And I just thought they were spending too much time together. In 2005, my cousin took them to Spain for a holiday. And on their return, my cousin asked if I had had a dementia test for Mom. Oh my God, that opened up another door for Dad and I. Life just seemed to go downhill. The last 7 years of Mum's life was bedridden. There was no real support at the time available, and we had to find our own way. In 2016, I gave up work as I could see my dad was struggling. Dad was a very sociable man, a very outgoing person, and did a lot of community work. Dad had totally given up on everything, and both our lives totally revolved around my mum. And this included my husband and family, had to devote a lot of time. And we decided to take care of Mum at home. In July 2018, I lost my mum to this horrible disease, but she was no longer my mum, as she didn't know who I was. And my grieving progress had started much earlier. Up until January 2019, everything was fine with Dad. We had a lovely holiday in India. After COVID began, both Dad and I had COVID in November 2020. I realized Dad was slurring. He was taken into a hospital and it was confirmed Dad had suffered a stroke, oblique TIA. Once he came home, he was having video sessions with speech and language. We didn't realize that he was missing lines when reading, and they suggested he gets assessed by the memory clinic. This was December 2020. This was when I realized that Dad was forgetting the time of day, the time he was taken in the shower, or he would say, I'm going for a shower in the afternoon. And he had already had one shower that morning. Finally, we had an appointment come through from Edward Street Hospital for 6th of March. That was 3 months later. We had a gentleman called Ben come along to assess Dad. And after doing various tests, he asked Dad to write down how he felt. He only wrote 3 words, I'm not well. Within a week, it was confirmed Dad had Alzheimer's and the beginning of dementia. So going down the same path once again, I thought I knew everything about dementia, but I was so wrong. Various organisations telephoned me and sent literature in the post as home visits were rare due to COVID. But on the 1st of April, Tirath called me from Crossroads. Immediately, we got on so well. She asked me questions and I opened up to her as I knew once again I needed help. And this friendly person on the other end sounded so helpful and reassuring. I felt supported with help. She even helped me order some equipment that my father needed. She advised me on incontinence. She advised me on benefit checks for Dad and myself. And the Crossroads sessions that she holds was a good learning curve. And so many things have been learned, especially when I thought I knew everything about dementia, but now realize no two people are the same. Giving contact numbers of who to contact, and on occasions, Tirath has made the calls for me. Other organisations have contacted me and just sent me literature in the post, but being a carer, I really don't have time to sit and read through it all. Crossroads carers groups have been so informative. They have been enjoyable, and you speak to others in the same situation as yourself. You share your experiences, you can open up and learn so much. As they are doing such a good job creating awareness and helping carers, as we often feel forgotten and lonely. Crossroads enhance culturally sensitive, and it's something in the ethnic minorities group I feel isn't quite understood about dementia. So yeah, they've been brilliant, but this awareness, there needs to be more awareness. I think that's about it really. I mean, my father's 99 now and he's not mobile anymore. He stopped speaking, which I don't know is a blessing or not, but we have little hymn sessions with him and he loves to sing. His singing ability is brilliant, but he just can't communicate now. But I'd say all I can do now is keep him comfortable. And that's my story. Sorry, I was trying not to get upset. Yeah, and it's been very helpful. Thank you having this session.
Thank you very much, Mina, for being here and really sharing your story with us. And even myself, just listening to you, I'm taken back as well. So, you know, we're grateful that you are able to share your story with us. And all I would say is, you know, I think in life, you just have to have that hope inside you. You know, hope is it's a really beautiful thing. And it gives us peace and strength to kind of keep going, you know, when all kind of seems lost. So I think we do need to have that inside us. And there's always sometimes that we have to accept that there are certain things that we cannot change. You know, there are things that are beyond our control, but we need to have that hope that we know we can carry on, we can keep on moving. And the fact that you've got, you know, in your story that you've had wonderful people around you to kind of support you through that journey. So that was really, really nice. And I think that's what we need to kind of reach out to those people, whether it's friends, whether it's family, to reach out, and those people that can help and support us through that journey in supporting. You know, hope is one of the main guiding forces in human lives, and we should never lose hope, no matter what we are going through. So we really, really appreciate you being here and sharing your story with us, really. Thank you very much.
Okay, thank you. It's been very good, thank you.
Thank you. Okay, we are slightly falling behind time and we've still got a couple of speakers left. We've also got our key guest speaker. We're going to very shortly take a comfort break and then introduce our key guest speaker. But before we do that, I want to introduce Tirath Kaur and Val, which Mina just mentioned as well. So I'll hand it over to them to talk about some of the service and some of the work that they have been doing in the Black Country. So over to you, Val and Tirath.
Hi everyone, my name is Tirath Kaur. And sorry, can you hear me? Are we? Can you hear us, Jason?
Yeah, we can hear you loud and clear. Carry on. Yeah.
Okay, my name's Tia the Core. I'm here with my colleague, Well Richard.
Hello, everyone.
We've been working for Crossroads Dementia Service for nearly 20 years now. We have been supporting people living with dementia and their families to support them to live in their own home for as long as possible, to help them to access the services from social services, OT assessments, financial assessment, and help them to get the benefits, and obviously educating the families about dementia, what dementia is and how it affects the whole family. And obviously we are supporting ethnic communities where there's so much stigma attached to mental health dementia, and there are myths as well, people not coming forward to have the diagnosis done. So that's where we come and we deliver dementia awareness sessions in the community to remove the myths and the stigma, which is it can be a taboo for this community to seek out the support and coming forward to the GP to explaining what they're suffering with, coming with a memory problem, and we emphasize on early diagnosis of dementia with obviously if it got to be very culturally sensitive how to approach the ethnic minorities, and obviously the language of heart, we speak the language, we can explain them better about dementia. We're doing these presentations in the temples, religious places, community centers, day centers, reaching out to people before they get into crisis, and the memory pathway, how to get the diagnosis, who to contact. Obviously the first contact is the GP, who you will contact for any memory problems, and we advise the families making sure they go with their loved ones to make sure they explain what memory lapse are, and where obviously to get the support and get the referrals to memory assessment team. And obviously if they don't get the information, they will miss out the early diagnosis, medical attention, social care, and also the help other communities are having. So we are playing a very important role to the ethnic minority communities to come forward and have the diagnosis done to get the appropriate support what they should be entitled to. And obviously there are myths attached to the mental health in ethnic minorities, like they say it's going to be God's will, or it's the natural process of aging, forgetfulness, or it can be genetic, where we're trying to remove those myths and the stigma to support the families. And obviously we deliver the presentations according to the audience. We tailor the delivery according where we are delivering where we're educating the families one-to-one in doing the home visits, and also in the community. And my colleague Val Morgan is with me now, and she will be explaining what type of delivery we are presenting out there in the community.
Yeah, and a lot of the actual concerns that's raised by carers over the years, we've actually sort of put it together in a presentation form, and that presentation we deliver is very visual rather than a lot of words, because I mean we're living in a visual society today. So we've created these presentations to be visual, and as we know, culturally sensitive, and according to the ethnic group we're talking to or we delivered a presentation to, we tailor the presentations to that culture. And what we found over the years, as Tirith has actually said, is that there are a lot of misunderstandings. There's a lot of concerns, there's a lot of worries. We know that the medical information is given, that somebody has got a diagnosis of dementia, but although they've got that sort of diagnosis, what happens? How do you live with dementia? How do you live well with dementia? And that's the information that's normally missing. And what we try to do is make sure that everybody who is a part of the sort of care factor, the family members, whether it be children, adults, even good friends, are aware of what the illness is about. We understand that the illness really takes into their memory, and the memory is the forgetfulness. But in addition to the forgetfulness, it's everything else that makes up that person. So it's the way they reason, it's their attention span, it's their judgments, their behavior. And as said before, communication. And we know with individuals who weren't necessarily born in this country, they will revert to their sort of birth language. And so all of that we address when we do our presentations. And the presentations isn't only for carers, we also give presentations to professionals as well, so that they're aware that really, you know, it's a case of it involves everybody, it involves the community. And really, it's taken away that overwhelming feeling that you get when you get a diagnosis of this illness. It's overwhelming for the person, but also the family members. And it's literally teaching that language of how we can communicate, live well, and really still have that good communication. There's a lot of ideas that's coming from all over to put together how we can live well with dementia, but it's having that communication. A lot of people do have queries that they don't necessarily want to ask to professionals or to doctors, but in the sort of small groups, in the family settings where they can ask those questions, and we do deliver these presentations, they ask it, and then they get the reassurance. If not the reassurance, then it's the ideas. And because we've worked in the community for such a long time, we have all these ideas that we put together and we put to the forefront. We spoke about, or it's been said already, about, you know, rugs and the colours can cause an effect with somebody with dementia, because it does, as said before, it doesn't only affect the memory, it also affects the visual side as well, an individual's hearing. So it's a combination of many different things. We hold a carers group, and at that carers group, what we actually try and do is give carers that platform to talk about their concerns, their fears. And because of that, we're able to sort of improve on our presentations whenever we deliver them. Because really, it's about carers, for carers who's talking about their loved ones. And that's what we try to get across in our presentation, how really we can benefit those within the community who's got this illness. It's an illness that is quite scary. And you've already got your fear factor already sort of there, and then you get that diagnosis. Well, we're taking away that fear factor. And I think, you know, forewarned is forearmed. You're actually knowing what you can actually do. And then with that information that you've gleaned, you can share it with others. So it's spreading the word of how to live well with dementia. And that's what our service really is about. You got anything else to say to it?
Thank you. Well, obviously, we're here to support people if somebody needs help, and obviously, yes, we will have our contact details and our referral form as well. Please, we always say, please ask for help. People are very reluctant to ask for help, and they struggle on their own. You don't need to struggle on your own. Accept family support from families, friends. Ask for support from professionals, and don't hide yourself. It is an illness in the brain, which people cannot see physically. It is from the behavior. Obviously, with our support and educating the families, we are teaching them. Obviously, we are learning from them as well how to cope with the behaviors, how to live well with dementia, how to share your feelings and talk about it. Just don't keep things in yourself. And obviously there's so many support services available out there. Just use them and come forward. And obviously people, there are young carers who are struggling, and obviously their finances, they need to pay mortgages, they need to pay the bills, and they need to work as well. Obviously there's a day centers out there and respite, and the services are available out there. It's just how to access them. So we work as an advocate for the families to give them information and guidance, and obviously legal matters as well, and talk about a mental capacity. We talk in their own language, which is very, very important. Please get help and use the services. Obviously, you'll find a society, they give them presentation, and there are so many services. Please do use them. Thank you.
Thank you very much.
Jason.
Thank you,
Thank you.
Thirat, and thank you, Val, both of you for delivering your talk and just talking about the services that you deliver across the Black Country. Now, I've visited your centre on a number of times, and I've seen some of the great work that you do, and even met some of your some of the people who actually attend your services. So it's a really, really vital service that you provide. And I think we've already seen from the comments as well, and how people have benefited from the services that you deliver. And also, I think the important thing, like what you touched on, is that you're able to deliver in different languages as well. You know, and I think sometimes it makes it so much easier for people to connect, open, and share as to what they're going through. And the key message, obviously, what you said, Theodore, is really seeking help, you know, really when you need it, and just opening up and accessing some of the support services that are available, whether it's through the trust, through the Black Country Healthcare, or local organizations like yourselves and others. There's lots of amazing services, lots of people doing great work around Alzheimer's, and there's a lot of support. But the key thing is people need to have that confidence to open up and access those services so they can get the help as early as possible. You know, to get a diagnosis. So yeah, really appreciate you being here, both of you. Thank you very much for your time.
Thank you.
And we will obviously share the details as well with the rest of the slides. I think we're doing okay for time, I believe. I haven't had a telling off, so I think we're doing okay. So what we're going to do, we're going to I think we'll give you guys a 5-minute break, and there's a condition attached to that you all come back. So we'll give you a few minutes just to stretch your legs, make yourselves a cup of tea or whatever you want to drink, and then just come back in a few minutes, 5 minutes, no more than 5 minutes. And then we will have a key guest speaker as well next. So, and really looking forward to listening to our next speaker. So see you back in 5 minutes. Right, welcome back, everyone. Hope you're relaxed and managed to get yourself a drink and ready for the next session. We've had some really, really interesting comments on the Menti poll that we did. It's been quite overwhelming, to be honest with you, some of the comments that have come through, really good. So we will share that with you with the rest of the slides after the event. I just want to say thanks to everyone else so far who's spoken. We'll just move on to our next key guest speaker that we have invited. She has a normally very, very busy schedule, and she's one person that I've met in my life that she can manage about 6, 7 priorities at the same time. I could never do that. I can just about manage on one, but she can do multiple tasks at the same time. I don't know how. I'm not going to do an introduction because it'll be unfair. I'll let her introduce herself, but she is known as the accidental entrepreneur. And she is the director of the Big Happiness Experience and Lean Into Life. And then I'll let her talk about her background. So over to you, Jules.
Thank you so much. Right, so what I'm actually going to do is I'm going to pin myself. So that means if anyone accidentally doesn't makes a noise or makes a slurp in their coffee, you don't get them on the screen, you get me. So what a fantastic event. And so I just wanted to say thank you so much for inviting me to be part of this. What I want to do before I introduce myself, before we do anything at all, I want everybody here just for a moment to pop your pens down, pop your mice down, and just be present where you are right now. Be present with the chair you're sitting on. Be present to the body that you are living in right now. And just be present in this moment. If it helps, because most of you are off camera anyway, just close your eyes for a minute. Close your eyes and just be with yourself. Doesn't matter that there's lots of other people here. This moment right now is all about you, just being present. And to help with that even more, you might want to place your hand over your heart just for a minute and feel that heartbeat and just be here right now, right here, right now. Okay, so my name is Jules Mitchell. You can open your eyes so you can see me. And I own a few companies. So yes, I am an accidental entrepreneur. And that's not the important part. The important part is what I do and how I am here to help. And when I was first invited to speak at this event, I was, okay, so where does this fit? How can I bring my knowledge, my specialist areas in to help and support all the people who are going to be turning up for this event? And where I feel I fit in is to support the supporters, to help those people who, good morning, Michael, thank you, is to help those people who help those people who are stuck and struggling and with this dementia. And so what I'm going to do is I'm going to share some slides with you. I've got about 15 minutes or so. I'm going to share with you today some knowledge and some information that can help you if you are a carer, some knowledge and information to help you if you are part of an organisation that helps both the carers and the people themselves that are struggling and suffering with dementia. So I'm going to share my screen with you so you'll lose my lovely face for a little while, and I will put this on for you. Okay, so let's put that on straight away. So the thing I want to share with you is something called Lean Into Life. Lean Into Life is is a training program where in the Black Country we got funding as an organisation. So our company, the Big Happiness Experiment, got funding to train up some coaches within the community to go out into the community and support their community in the mental and emotional health field. So we are boosting the mental and emotional health of the community with specialist Lean Into Life coaches. Now, that funding for this particular project was from the Health Inequalities Initiative, and we started last September, running through to July, and we have got all of these lovely people already trained up as Lean Into Life community coaches. Now, the main ethos of our training is that we are helping communities to access services that are not available for themselves currently. So that could be because a person does not speak English. It could be because of cultural differences and backgrounds. So all of our coaches are bilingual generally, okay, so that they can come, they can get the training from us, and then they can go into their community and deliver these programs in a way that fits within that community. So you'll recognize a few people on the screen. You can see Yasin Mohammed on there, and a few people. So sorry, I always put my chat on and lose that. So this is what we do, okay. There's a few more close-ups of the people you might know. But what I wanted to share with you in this short period of time that I've got is some real tangible, let's get the word out correctly, some tangible tools to help all of those people who are in the support roles. So family members, people in organisations that are supporting people, we all need to put on our own oxygen mask first. If you're on a plane that is just about to go down into the sea and you are a parent, then the first thing you have to do is not look after your child. The first thing you have to do is put on your own oxygen mask, because if you're not breathing, you cannot look after your child. And that is exactly the same for anybody who is supporting and caring for somebody who has dementia. Okay, so we have to look at, what can I do to look after myself? What can I do to keep not just my head above water today, but actually to build my resilience, to actually give me strength? And I know, Yasin, you used the word hope, to give me hope that I can get through another day with hope at the end of it and not be completely depleted. So the thing I'm going to share with you, because normally I would have quite a long time when I'm explaining this information, and I haven't today, so I've thought, right, okay, I want to go straight there. I want to go deep dive, and I'm going to share some information with you that should make a difference to you today. And the first thing I'm going to say to you is, we as human beings think that everything that we think impacts on our world, okay? Everything that we are worrying about or thinking about is the thing that's causing us maybe to feel anxious, to feel overwhelmed, to feel stressed, to feel frustrated. We think that it's our thoughts, and of course our situations do contribute to that enormously. But our thought-based information is actually a really small number compared to the way our body perceives our stress. So we have something called neuroception, okay? Now, neuroception is the body's way of perceiving whether the body it is inhabiting is safe or not safe, safe or unsafe. Our thoughts are our perception, aren't they? We can perceive something with our thoughts, but our body perceives something with all of the data streams of sensory information that's coming through to our body on a second by second and millisecond basis. So the best way to sort of explain this to you is to introduce you to your stress bucket. Everyone will know we are stress buckets when we are overwhelmed, but if we can use your stress bucket as a metaphorical term for your stress, and say that every one of us has a stress bucket and we have stressful situations happening all of the time. That stress comes into the bucket, and of course, if the bucket isn't emptied, the bucket will overflow. Our bodies are designed to actually release that stress on a moment by moment basis. We have automatic systems in our body that help us to deal with danger, deal with threat, deal with stress, and then let the stress out. Okay, so we've got two different systems, one that turns us on to make us aware and to be able to deal with things, and another system that comes along and shuts all those fight or flight responses back down so that we can be nice and balanced in the world. Unfortunately, we live in the 21st century, and of course the people who are all here on this particular webinar today are dealing with highly stressful situations. So what do we do? What do we do with those stress taps? Well, there's lots of things actually that we do that we think are helping to relieve the moment, to relieve the stress. But sometimes they don't. Sometimes they're just plastering over the cracks and thinking that I'm just going to get through another day and this will bring some relief to my body, it brings some relief to my mind. These are what I class as your Band-Aid behaviours, okay? Band-Aids are plasters, and very often what is happening is, unfortunately, we are putting a Band-Aid over a bullet. It's not going to work for a very long period of time. So we have these things that we do where we busy ourselves, we battle on with our protective personalities, we avoid situations, people, tasks, feelings, thoughts. We numb ourselves to emotional pain using addictive behaviours such as drink, drugs, shopping, etc. And we distract ourselves with things like social media, TV, news, magazines, gaming, etc. So I'm sure as I've read that list out to you, and you can see it on the screen, you can recognise what things you might be doing that fit in with these Band-Aids. And I call them your weapons of mass distraction. We are wanting to escape the world that we're living and the circumstances that are happening in our lives. And to do that, we'll use these type of mechanisms, these dealing, coping mechanisms to help us get through another day. What we do in Lean Into Life, and we teach all of our community coaches, of which by the time we've finished our training, we have 60 coaches within the Black Country. We provide them with an education-based toolkit that helps them to take information to the community that helps everybody to start turning the taps on of that bucket, okay, to actually let the stress out, not to distract, not to numb, not to avoid, not to busy, but to actually release the stress and turn on those stress valves. So we call them bite-sized boosts, and we sort of talk about lots of things within the training. We look at neuroplasticity, we look at psychology, we look at somatic work, looking at the body, and they're brain biohacks that we can use. So I'm going to share a couple with you today because I wanted to give you some tangible take-home tools. So the first one I want you to do, I'm going to come off the screen. No, I'm going to stay with the presentation because it just makes it a bit choppy otherwise. What I want you to do is take your pointy finger, ladies and gentlemen, and place it on your frown muscle. Okay, so in between your eyebrows, there is a frown muscle called your corrugator supercilii. I want you to take that finger of blame that we are placing out into the world and bring it in and place it on that button, okay? This is your O button. Your O button, when you press it, you say the two words or the sentence, you go, oh. Oh, now where do we use that? We use O as an observation tool. We are bringing some psychological distance between what's happening in the body, what's happening in the thought process, and bringing some space and bringing some awareness into our bodies, and into our minds. So we go, oh, I notice the tension in my shoulders. Oh, I notice I'm feeling anxious. Oh, I notice there's a pit in my stomach right now where I feel sick. Okay, we're bringing awareness into the body and the sensations in the body. And I'll talk about, if I've got time, I'll tell you why that is so important. Okay, the second tool I'm going to share with you is called I Can Handle This. Now, this is a psychosensory tool that I thought for the audience that we've got here today will be a great tool that everybody can use immediately. So whenever you are in a stressful situation, your body gets put into this alarm mode. When your body is in alarm mode, the thinking part of your brain doesn't work. It goes offline. We go into safe mode and we cannot function properly. So to enable that part of your brain to switch back on and to help you to have some cognitive function and to be able to think clearly, we need to use something that's going to be body-based to bring safety into the body, okay? So all you need to do this time round is to put your palms of your hands together, and you're going to just stroke them back and forth. Just stroke the palms of your hands together, back and forth, not fast. We're not causing friction here. We're just stroking the palms together nice and gently. And alongside that physical movement, you're going to say to yourself, I can handle this. Now, if you know how to do a nice deep belly breath, then you can do that alongside this, or you can add another quick breath where you breathe in through the nostrils and out through the nose. Okay, so you do 2 quick breaths in and then 1 long breath out through. So in through the nostrils, out through the mouth, sorry, in through the nostrils, out through the mouth. So we go, and you would repeat that. What you're doing there is a physiological sigh, which is sending a message to your brain to say that in this moment, you are actually safe, everything's okay, and it will help your body to get back into balance. So there you go. You've got some real tangible tools that you can use. If you want to know more about us as an organisation, Big Happiness, or to actually find out about Lean Into Life and where all the coaches are in the Black Country, then you can contact myself. Obviously, our full details will be sent out via the usual channels. But where does it all fit? Well, it fits in with the existing mental health system as an empowering education and self-help toolkit. It's not a treatment, it's not a therapy, it's an education model to support the current treatments that are available. So if you want any details, my number is on the screen right now, so this will come up as part of the recording and the email. And I will take myself off share. There we go. And I hope that that little tiny glimpse into our world will have given you something today that can help you to put your own oxygen mask on, either as a carer or someone who works in an organisation that does the amazing work that you do, and that we can then help you all to live well and to live with hope. So thank you so much for the opportunity to share this with you.
Brilliant. Thank you very much for that, Jules. Really enjoyed that exercise, and it's really done me good as well. Just sitting here by myself, all stressed out. So it's really been good. Now, most of us in our team, the community inclusion team, have already attended your course, Jules, and you know, we did the full course, and it was really, really great. And it really kind of gave us an insight into a different way of how the course that you put together can help and support people in different situations. And it's really helped me personally as well. And some of the learnings that I've took from there, and also some of the learnings that we are now applying in delivering that course into the different community settings as well. So we thoroughly enjoyed it, and you know, I'm glad I attended the course. And most of our team are now Lean Into Life coaches.
Yeah.
And yeah, and we don't know how we become coaches. Again, I think it's got have something to do with that, becoming an accidental entrepreneur. So yeah, so really appreciate your time, Jules. I know there's been some comments in the chat as well around some of the things that you've just talked about. So if you can just pick up some comments, if there's any questions as we go along, really appreciate it. Are we okay to share your slides as well, Jules?
Yes, please
with
do.
the rest of the,
Please do.
So we,
Yeah.
we will share the slide and the contact details, and if anyone wants to get in touch with Jules, please do. It's a very, very thoughtful presentation and a training program put together that can kind of help yourselves and also some of your organizations that you represent as well. And it may just be worth having a chat with Jules as well to see how it can benefit the organization that you represent. And I'm sure she can, she can provide more details with regards to the content of the course as well, or any other questions that you have. So we will share those with you. And I just want to say thank you, Jules, for taking the time out and, giving and sharing your thoughts with us.
I'd like to just say one thing though, Yasin. You
Sure.
mentioned that I multitask. None of us can multitask. Our brain is not designed that way. So be present with one task at a time, and then you will be able to move on to the next one.
Brilliant. Thank you for that. Okay, we're almost approaching our time. So we've got just one more speaker. I'm going to quickly hand over to our last speaker before we start wrapping up. And our last speaker is Dr. Rashda Tabassum, who is an old age consultant psychiatrist working in the Bloxwich Hospital at the Black Country Healthcare, and who has significant experience working with people from all ages suffering from complex mental health issues. For the last 15 years, she has worked with people above the age of 65 and has gained a deeper understanding of the problems faced by the elderly population. Now, Dr. Rashda also launched the Christmas gift campaign that has since been covered by the BBC, aimed at tackling isolation and building social integration in the community. And I'll hand over to Dr. Rashda now. Over to you, Dr. Rashda.
Thank you. First of all, thank you very much for giving me the opportunity to join. I didn't realize that there will be a variety of audience there. And I'm really glad to see that so many people are attending this webinar, though I could not obviously join in the beginning. So I did not know what else has been spoken about, but Jules' talk was quite interesting and very beneficial. Mainly, will you be able to please share my PowerPoint? So it's a just simple, straightforward PowerPoint actually about mainly what dementia is and how the dementia in BME, actually we can see that what are the main issues for them not to coming to our services, because my interest, special interest is raising awareness of mental health in the Black and ethnic minority community. And that's what led me to make a DVD as well, which was launched by Royal College of Psychiatrists, and it is available on YouTube. But so mainly I'll give you some facts and figures, and then at the end, if any question, I can take the questions. Yeah,
sure.
Thank you.
We'll try and put your slide up, Adam.
Yeah.
If you can put the slide up, please, buddy.
Thank you.
Thank you.
So yeah, now people know who I am. So if you can go to, yeah. I mean, just you can see and you can imagine that dementia is becoming a pandemic. Already about 1 million people in UK, they're estimated to have dementia, the age of above 65. And worldwide, this number is rising quite steadily as well, because we know the people are living longer, and that's why the prevalence of dementia is also increasing. So about 35.6 million, according to WHO. 2012, it is now you can imagine it's more than that. And obviously dementia costs a lot, about 23 billion a year, even more per person than median UK salary. So this obviously, I was focusing on that how many people from minority ethnic group, they have dementia. So roughly the figure according to Department of Health is about 15,000 people. But it is quite obviously in 2010, the figures must have changed. Now it has been 13 years. And I couldn't find the update figure on that, but you can imagine the rate will be, obviously prevalence rate will be high. I mean, now knowing that how much the dementia is because of the age longevity is going up, but only 1/3 of people have some form of diagnosis out of all these. This is a study by National Audit. And because of that, they were concerned that people not knowing the diagnosis earlier will not be able to get access to the treatment and the social support in time. So dementia strategy proposed that we need to improve the public and professional awareness that how to diagnose and public to know what are the signs, symptoms, and they can approach to the so dementia strategy has given this one of the that we need to diagnose people as early as we can. Next slide, please. Obviously, as you see that the people, when they experience dementia, it has a profound implication on their and their family. They can't live independently as it progresses. And can you imagine the cost of this, including the carer input? And usually it is an informal input by a lot of family. So it costs so much that the Alzheimer's disease alone exceeds the total cost of stroke, cancer, and heart disease. So it does cost to the family. Obviously, independence is lost and costing the NHS and also people approaching to the private organization. So that's the reason it is very important to detect the dementia at an early stage to have a better management plan and given the opportunity to the person so they can make a plan while they still have some insight, while they still have capacity to make decision. And so it's better to, like, before it decline and they can't further save in terms of their advanced wishes that they need to do. So yeah, please, next slide. So you can see the above 65-year-old, 5%, and as the age progress, you can see that by the age of 80, 20% of people are already experiencing some kind of dementia. So the prevalence increase as the age. So age is a risk factor. The next slide, please. And the most common form of dementia is Alzheimer, which is 60%. So there are quite a lot of different forms, but the major are kind of Alzheimer dementia, vascular dementia, Lewy body dementia. So Alzheimer is most common in Caucasian population, and female have more prevalence of Alzheimer dementia. Vascular dementia is 20%, and Lewy body, which I haven't mentioned here, it's around 20% as well. So people obviously can have mixed type of dementia as well. The life expectancy after being diagnosed with dementia can be from 5 to 12 years. It depends at how early the diagnosis was made. So this is a roughly epidemiology that what kind of dementia are more prevalent and how long the people are going to live after that. Next slide, please. So what is dementia? Mainly dementia actually affect the global functioning. So it affects the memory, intellect, language, and our thinking process. People become confused because they lose the track of the time. They become disoriented in time and place and people. They can't comprehend and they can't make decision. And because their learning capacity is compromised, they cannot actually have a new learning. Sorry, 1 minute. I'm just busy. Just give me 2 minutes. Yeah. Sorry about that. So, and because of all this losing, obviously, their higher brain functioning, they lose emotional control, and you can see a lot of behavioral issue happens when people start with dementia. They can't look after themselves, and gradually it becomes so severe as it progresses. The people can actually become more and more dependent. They lose their mobility, and they're more dependent on care and bed bound and eventually palliative care. Dementia, obviously, people can have still clear consciousness. People are still alert and awake, but they are confused. It is progressive and irreversible. Next slide, please. So major causes of dementia are like some causes are like Alzheimer, Lewy body frontotemporal dementia, Parkinson dementia. These are neurological causes. In our brain brain cells start dying, and then they cannot be made again. So it becomes like a plaques in the brain. You can see that some kind of you will see because of the death of these cell, the proteins they make these plaques. So mainly it is due to as we progress, our brain does degenerate, but people who actually start having dementia, their degeneration of the brain is more compared to their age. And so it shows that it is due to this degeneration of their brain. And then some people, when they have a diabetes or high blood pressure, the blood supply to their brain is compromised, and it can cause some vascular damage. So with the age, some vascular changes happen in brain, but if there are some vascular risk factor like stroke, and I mentioned diabetes, blood pressure, it can cause some changes in the brain, which can cause the memory problem, and it is called vascular dementia. Next slide, please. So sometimes there are causes when people appear confused, forgetful, and we need to find out there are some causes which can be treatable. Like if people have any hemorrhage in their brain, if they have any infection, trauma, any maybe tumor, and any inflammation in their brain arteries, or there's a renal failure, any cardiac issue, anemia, vitamin deficiency, if they have any hypothyroidism or any hydrocephalus. So these are the causes which can be for these, can cause a picture like dementia, but these are treatable causes. And that's the reason usually we request for a head scan to rule out these causes. So this is another reason people need to keep in mind that they need to do all the blood tests and things to rule out any treatable causes of dementia. Yeah, next slide, please. So as I mentioned before, that early diagnosis is very important, and ruling out the other causes as I mentioned before. So it's very important that we take the full history, if possibly from patient. Sometimes patient, obviously they can't give the history, they don't have insight. So it's very important to take a history from the relatives, from the friends, from the co-workers. And it's very important that you see the patient as soon as the referral comes. And it's very important that maybe if patient is seen at their own home, in their own setting, because then you will be able to see that how they're functioning, if there are any risk in terms of self-neglect, in terms of poor nutrition, in terms of running out and not able to put the food in the fridge, shopping or falls. So multiple things when you go, you can see at home. So it's ideally to be seen at home, which I think our memory service mainly do that, but sometime in outpatient relative, bring the patient and you can see it there. Yeah, next please, slide. As I said that, first of all, when you go to the GP, so the expectation will be GP will do the full physical examination, and they do all the blood tests to rule out any underlying physical issue. So the blood test, you can see, I won't go into any details. And then GP, sometimes they have a very brief 6 CIT tool for assessing memory. And lately, I think people who have diabetes, high blood pressure, when they go to GP, they do on them, particularly people above 65, they do this brief memory test. So to see whether there is any memory issue. Sometimes people, their family and patient are not aware. So, and after that, they can also offer them to refer to memory service. In memory service, they can be seen by the memory service nurse and doctor. And if they need any further assessment, then a comprehensive neuropsych assessment can be requested as well. If there is any complication, any confusion about the dementia, then this further specialist assessment through neuropsych can be also assessed. Yeah. So on based of all the history investigation and memory tests, then we can give the diagnosis. Yeah. Next, please. As I said, that it's very important. Sometimes people, if they are depressed because their attention concentration is very poor and they appear to have poor memory, they will come to the doctor or professional and say, I think I have a poor memory. And it's sometimes in terminology called pseudo dementia, where people is actually depressed, but not dementia is not there. So it's very important to see if they're depressed, they should be having treatment for depression. And after that, assessment should be done. Then at time, people in above 65, if they have any mild infection, they can even go into delirium. And delirium in which they become acutely confused, they become disoriented in a very short period of time. So if you see that there's a sudden onset of confusion, then it could be delirium. And if people have dementia, they're quite prone to delirium. And it's very important to treat delirium. So making a differential diagnosis, and at time organic amnesic syndrome due to people who drink a lot alcohol. So it could be Korsakoff syndrome. So it's very important. That's the reason we need to rule out all these causes and any toxic state. Sometimes people, they start taking any medication which can make them very confused. And if there is any mild, moderate, any mental retardation, they could have a diagnosis of dementia by the age of 40. The people can have Alzheimer dementia at that if they have mental retardation, learning disability, sorry, it's the wording should be changed. Yeah, so we need to differentiate from these diagnoses, that whether it's dementia or any. Yeah, next slide, please. So now the management is very important. As I said, that once a diagnosis is made, the management should be based on biopsychosocial model, that if a patient has any physical issues, we need to make the family aware that if a patient has any underlying pain, constipation, any even simple things, even constipation can make people confused. So it's very important to keep an eye that pain is also a big factor causing more confusion. So GP need to look at patients' physical health in terms of keeping their diabetes, blood pressure stable. And if patient has a diagnosis of Alzheimer dementia, Parkinson's dementia, Lewy body dementia, then we offer them acetylcholinesterase inhibitors. These are the medication which actually stop one of the enzyme which is called acetylcholinesterase, which actually metabolize acetylcholine, which is for memory, very quickly. So we give these medication to stop the metabolism, and so acetylcholine does not get out of the body. So we offer them, there is a variety of medication available. So if they are suitable, there are no contraindication, then it can be started. If there are any comorbid problem like any psychosis, depression, agitation, aggression, then we can give some small doses of antipsychotic. But before that, it is very important that a patient has been seen by a psychologist as well, who can offer the distraction techniques rather than giving antipsychotic with behavioral issue, because people with dementia, they can be prone to stroke and heart attack. So it's very important that the antipsychotic should be the last resort and not to be given as a first management. And very important aspect is social support. So after OT assessment, we need to do a thorough risk assessment that whether if not, then obviously we have to find a care home setting and we have to look into that. Thank you. Can you, next slide, please? So now I'll just focus briefly on a Black and ethnic minority population. About, I will say now, with the current consensus, there is a 20% of population in Midland is from Black and ethnic minority. So these are the, I think, a little bit older data, but roughly the population for BME has increased more. Yeah, thank you. Next slide, please. So knowing that the population of BAME community has increased, and about half of the minority ethnic group in UK have their origin from South Asian origin. They have these people, they migrated in UK in 1950s and 60s at a young age, but now they are coming into that age range where they are actually developing prevalence of dementia is becoming more in South Asian community, in other Black ethnic minorities. And they are also composed of a very heterogeneous group with different background of religion, language, and culture. But investigation of their mental health has been neglected compared to their physical health. And this is my personal research, which I have done many years ago. And recently, when even 15 years ago, I did a survey that how many people from Asian origin or Black and ethnic minority are referred to mental health services. And the figure says their referral rate is very low compared to the percentage of their population. Next slide, please. So this is mainly the Walsall, because when I actually made the slide, the Walsall Trust did not merge into Black Country, though we are a part of Black Country now. But I think in the Walsall, the figures of ethnic minority remain 13.6%. So almost 1 in 6 people in Walsall are from minority ethnic group. Yeah, next slide, please. So knowing that the number is increasing, but they're still under representative in dementia services, and the policy guidance about the BME people with dementia is not established. So that's mainly, I haven't seen anything done yet about this. So maybe we can just at the end discuss if anybody's aware that any particular guidance has come, how we can access to these people. Thank you. Next slide. Although BME population is aging rapidly, but you can see that to attempt to raise the awareness of dementia in BME has been minimal. And not knowing that the people, their families, if they are not aware, they won't bring to the GP. They think it's just an aging process. And when the process become quite advanced stage, only then they have to have a help and they will come to you. So obviously, because of the education and cultural background, their expression of cognitive problem is also different from indigenous population. And they manifest and influence the family in a very different way. So how we know that, what are the factors which influence individual and family, and how we can make raise more awareness? There have been some, I think, effort in terms of community workers and like some outreach worker, but not sure how much it has been done. So we need to, if you please go to the next slide. What are the barriers? We need to see that as well. So what happens, because their referral rate is very, very low to the secondary service, because they have lack of knowledge about dementia, their language skills, the barrier, language is a very big barrier for them. And also they think that because of their language and cultural background, the clinician won't be able to assess. So from the clinician and the training is not there that they can understand there. So there is a lot of bias and prejudice from clinician. Yeah, please, next slide. The other thing is a lot of stigma. First of all, lack of awareness, then stigma in the community, BME community, because it's very scary for them to go to the doctor and finding out this diagnosis, and then that's another, they don't accept that something has gone wrong, they won't come. So again, the education, language, and the tools, assessment tools are quite biased. Like if you see that all the diagnostic tool, they don't have any, though lately there have been some tools they have modified that the people who are not literate, they can be assessed, but still they're not well aware. That I haven't seen being used very well. So these tools are for educated people, the assessment tools. So that's another, so there's a lack of cultural sensitivity in management as well. So these are the barrier on both ends, from community and from clinician. Next slide, please. Obviously, they need to know that what can be the consequences. Because there's no cure for dementia. So it's very important that the family they come in time to approach the services in time. So they need to get the management according to their cultural needs and rehabilitation. I have personally seen quite a lot of family who obviously think they have extended family, but now things have changed. All the women from just second generation, they're educated, they're working, and it's very difficult for them to have a burden of care, particularly women. They end up having a burden, taking this burden of care, and they have to stop working, and they don't know how to use the system, which is not catering the needs. Yeah, thank you. Next slide. So as I said, that there's a complexity how to approach to health and social care system, so much paperwork, so they don't know where to go, how to complete the paperwork, and also in terms of services, because they are not aware where they can provide the appropriate culturally sensitive staff for domiciliary care, respite, sitting service, and particularly about residential care. Now, I have seen some people are coming, but people are still think that the residential care doesn't meet their needs. And obviously, sometimes people, these are mixed sex residential care, which sometimes doesn't meet their cultural needs. So I can say that the BAME community is quite suffering in a way, in a silence, that not approaching and getting the right help. Next slide, please. So I will say that one of the study found that over 50% do not receive subsequent medical evaluation in spite of going to the GP. So it's very important that public health education program should be there to raise awareness in Asian community and also give them the confidence that they can approach to the services. So based on all these findings, and I made actually DVD and some leaflet, which is this DVD is in 2 languages, Urdu and Punjabi. It is called Journey of Memory, and it is one of the short play to engage the community in which I just highlighted the main symptom for dementia. And end of that DVD, then I just give the some professional talk that what they are supposed to do and where to go. So DVD has been, as I mentioned, launched on this YouTube now from Royal College of Psychiatry, and people can go on YouTube and they can find this DVD if they want to raise awareness through their own organization to the staff. It can be used. Yeah, next slide, please. So in terms of key messages, staff can adopt several approaches to improve the uptake of services, such as developing different information resources, as I said, in form of leaflet sometime or whatever is now. Things have changed, obviously, with technology. So we need to see that how through the social media we can raise more awareness, and appointing workers with responsibility for outreach, training on how to give culturally acceptable care and support to BME people. Support in form of carer groups and respite service may be appreciated, and evidence based on supporting BME people with dementia and their carer is very limited. So we need to also, I think, do some more research in this field. Next slide, please. So for staff, it's very important that the evidence based on supporting BME people with dementia and their carer, because it's very limited. So maybe if staff they see and they can also give their input and feedback into the trust, it will help them to develop their services, involving families and mobilizing community, also involving religious leader and healers, because they are the one where people go at the first instance from BAME community first time when something happens in a family. So they're their first point of contact, and also support in form of care groups and respite. Yeah, next slide, please. Yeah, I think it's just a repetition, so we can go on next. Next slide, please. So this is the DVD, which I actually went on a this was a event where I just it's one of the TV artists. I don't know if somebody I said. Yeah, next slide, please. Yeah, so these are the people actually who helped me with the DVD. So I just the acknowledgement. Yeah, that's the end of my presentation. Thank you very much for listening to me. And if there's anything, please, you want to ask me, I'm ready to respond.
Thank you very much, Dr. Rush. I really appreciate your input. Very comprehensive presentation there, lots of information. There's one or two questions with regards to the video links that you mentioned on YouTube. If you can share them with me, send them to me. What we can do is we can include them in the slides when we send them out to all the participants.
Okay, lovely. Yeah, I should have done that, but I'll send you that. Thank you.
Yeah, some really good comments coming through on the chat as well. So if you want to pick up them as well, if there's any questions.
Yeah.
Before we let you all go, we just want to do a final survey just to get some feedback on the Mentimeter. Adam, if you can put that up, please. And then we'll start wrapping up. We'll let you go. It'll just be a couple of more minutes and we're nearly done.
Thank you. Just one quickly, somebody asked me if the CT scan is essential prior to referral. No, you can refer to memory service and they will do everything by themselves.
Brilliant. Thank you very much for that.
Thank you. Thank you for giving the opportunity.
No problem. You're welcome. Yeah, so it's similar format to what you did before. If you could just go on to www.menti.com and just use the code above 15322311, and one of my colleagues will put that in the chat as well. And yeah, and really this is just to gain some insight and some feedback from today's event. Brilliant. We can see some responses coming through now. And as we see the responses coming through, I really want to just take this opportunity. It's been a great event and really insightful with lots of good information from all the speakers. And it's really kind of opened my eyes up as well at looking at the dementia and the support that is really, really needed for communities, not just across the Black country, but much wider, and what we can do to help and support. And really, I just want to give a message of hope, as always, to whatever you're going through, whether you're supporting a loved one or anyone within your settings, just to never lose hope, and also to kind of look after your own health and well-being as well. I mean, never lose hope. I think it's in our human nature to lose hope in challenging situations. When we're faced with challenging situations, family and loved ones can easily kind of, give up and suffer from hopelessness if they do not receive the proper support and care. But we can easily cheer up someone close to us with messages filled with love, hope, and inspiration. And I always say this: just, is when the caterpillar thought the world was over, what happened? It became a butterfly. So the moment you're kind of ready to quit is usually the moment right before a miracle happens or something positive happens. So always have that hope inside you. Don't give up, don't quit. And the key thing is believe in yourself, whatever you're going through, and hold on tight to that rope of hope. And I really hope that this event has been useful in some ways, and you're able to take something away and share. If you have any queries, any questions outside the event, feel free to get in touch with us. You've got our contact details, reach out to us, and it'll be good to hear from you, and we'll happily be able to answer any key questions. If we can't answer them directly, we'll get in touch with the speakers to provide a response, and then we can share that with you. But I just want to say, on behalf of the Black Country Healthcare NHS Foundation Trust, I want to extend our sincere thanks to all the speakers who have joined us today. Our comms team, with a special thanks to Lottie, and the community inclusion team for making this webinar possible. We also have the 24/7 helpline as well. I wonder if you can put that in the chat as well, Jenny, please. Which is 0800 008 6516. You can ring at any time if you need any help and support as well. that is accessible 24/7, and there are trained counsellors on the other end who will be able to listen and kind of signpost you to any help and relevant support that you need. You can also access the Black Country Healthcare website as well. It has lots of information and to kind of signpost you in any particular direction that you may require. And really just to stay safe, stay positive, look after yourself and the people around you. We're always here to help and support in any way. To get in touch with us if you need anything from our end, from our side. We also have, I just want to mention that we've got the mental health, being the mental health week as well. We have our mental health event on Thursday as well. If you haven't already signed up, please sign up for that as well. But we will have more events coming in the coming months as well, and we'll keep you in touch and informed of the forthcoming events. And hopefully you can join us on those as well. So until then, really, stay safe, stay healthy, and really thank you to every one of you from our end. And hopefully, we will see you again soon.
Thank you. Bye.
Pleasure.